Hello, everybody. Good afternoon. You have my voice, okay? It's my pleasure to be with you. I'm Dr. Ehsan, a specialist occupational medicine in Emirates Global Aluminium in Dubai. Today, I'll be talking about safeguarding lives. At the initial part of my presentation, I will talk about occupational hazards and most common work-related disorders. And the next part, I will talk about preventive strategy to control the occupational diseases at workplace. Uh, as you know, work is a social determinant of health, and it is very useful and it is very good for men and also for women, and increase the self-esteem of employee of a working population. But sometimes we have some hazardous condition and some workplace hazard that threaten the health of employee. We should have a program to controlling this hazard, and actually during occupational health program, we try to control the interaction between work and health. This is our most important responsibility as an occupational health team. For example, during pre-employment medical examination, when we hire an employee, we try to do medical examination to find the underlying disease of employee, his habits, his diets, his psychosocial condition, to make decision and determine fitness for work of employee. It is a kind of managing the effect of health on work. During employment period, we try to protect the health of employee against our workplace hazard and also promote his health uh, by some intervention, by preventive intervention. Our ultimate goal finally is retire a people and employee with a health condition, with a healthy condition, appropriate healthy condition, and hand them over to family, to community, because as you know, occupational health program not only affect of family of employee health, but also has a significant effects of community health. There are five categories of workplace hazard at the workplace that threaten the health of employee. The first category are physical hazard like noise, vibration, uh, ionization, heat condition, heat exposure, especially in, as you know, in GCC countries, one of the most important problem and issue is heat exposure. Another group of ergonomic hazards that like for example heavy manual lifting, prolonged sitting, standing, and working in the awkward posture that, as you know, they usually cause work related musculoskeletal disorders. The next category of workplace hazard are psychosocial hazards, like for example night shift work, like excessive workload, poor support, and things. They can increase the risk of occupational stress and bring some mental disorders for employee. The next group of chemical hazard, there are different kind of chemical hazard at workplace, like dust, fume, gas, carcinogen chemical like asbestos, silica dust, and things. And the last group are biological hazard that usually we have challenge with this kind of hazard at healthcare setting. For example, influenza virus, COVID-19 virus, tuberculosis, and things. And we have a lot of case of work-related infection among healthcare workers. If the exposure with this hazard is high, and the employee has high dose exposure with this hazard, can cause occupational accident or acute diseases. But most of the time, the occupational disease has a chronic pattern. I mean, they usually occur after long time low dose exposure with occupational hazard at workplace. One of the most common disorders among employees these days are noise-induced hearing loss that you can see in this slide. I did this. This usually start with the notch in the 4,000 hertz in audiogram, and this step the usually patient and employee doesn't have any significant symptoms, because as you know, noise-induced hearing loss is a painless disorder. As you can see in this graph, in the four and fifth graph, maybe patient and employee has a some hearing loss and some tinnitus and things, but most of the time Occupational and noise-induced hearing loss doesn't have any significant symptom and it is painless. Occupational noise-induced hearing loss, if the exposure with noise continue, this notch in 4000 hertz, as you can see, will become deeper and deeper, wider and wider, and increase. So the noise-induced hearing loss, it can be progressive disorder. And if we can stop the exposure with noise, we can stop the progressive of noise-induced hearing loss. Noise-induced hearing loss is a permanent disorder because noise exposure affect our hairy cell in inner ear and auditory nerve. So it is not a curable disease. It is an irreversible hearing loss, but it is preventable. The employee that exposed with noise is available. The hazardous item, I mean noise is completely known. We can try to protect and prevent this disease easily. I will talk about the prevention in the next slides. Noise-induced hearing loss is not the only effect of noise exposure at workplace, but exposure with noise can affect on other organs in the employee. For example, it can cause a sleep disturbance, it can cause some increase the stress of employee and bring some mental health condition, and also increase the risk of cardio cardiovascular disorder, because as you know, exposure with noise raise the blood pressure, raise the blood sugar, and alter blood lipid profile. And as you know, they are most important risk factors for cardiovascular disorders. So if you have a case, for example, with resistant high blood pressure at workplace, or you have a case of resistant diabetes at workplace, you should check the noise exposure at work, because as I told you, noise exposure can increase the resistance to antihypertensive medicine, anti-diabetes medicine, and it is one important challenge and issue during occupational medicine screening. We have a lot of cases of high BP, high cholesterol, diabetes at workplace. They have exposure with noise, and we should think about noise exposure. Occupational lung disorders are another common work-related disease among employee. Distant decades, we had a lot of cases of pneumoconiosis due to exposure with respiratory silica dust, asbestosis, coal loss. But fortunately, these days, we see them less often than previous. As you can see in this picture, it is one of my case. He has a severe silicosis. He worked as a agate grinder for about 20 years. As you know, agate is a semi-precious kind. It is a hard silica that's used for producing jewelry and accessory. Pneumoconiosis is a kind of interstitial lung disease. It is an irreversible disease because, as you can see in this chest X-ray, the lung parenchymal disturbed. But these days we have dealing with a lot of case of occupational asthma. Actually, occupational asthma these days is the most common work-related lung disorders. It's a kind of inflammatory disease in airways, and that's during asthma causes the airway inflamed and constrict, and patient come to us with shortness of breath, chronic cough, wheezing, and this kind of symptoms. And these days, as you know, there are a lot of asthmagen factors at workplace. For example, hydrogen fluoride in aluminium industry that now I'm working is a known asthmagen factor at workplaces, or organic dust in food industry, for example, or organic hydrocarbon in chemical industry. They are most common etiology of occupational asthma among employees. Work-related contact dermatitis is another common disorder among employees. They are usually happen after long-term exposure with chemicals, irritant, allergen factors at workplace, constant and long-term exposure with chemicals, frequent glove use, and wet working. They are most important etiology for occupational dermatitis, and they usually happen in the backs of the hands and between fingers, with this most common symptoms among employees: redness, itching, blister, dry skin, and things. And one of the most important risk factor for dermatitis is frequent use of gloves, and we have a lot of cases of occupational dermatitis among healthcare workers because, as you know, about 10 to 15% of healthcare workers has a kind of occupational dermatitis. Work-related musculoskeletal disorders is one of the another most common disorders these days among employees, especially low back pain, because as you if you work in the industry section, industry uh, uh, sectors, you had a lot of case of low back pain, for example. Musculoskeletal disorders usually happen in different organ, neck, back, wrist, ankle, knee, and as you know, there are very common among general population. And so we count these disorders as a work-related, not work-induced. Obesity, smoking, general disease like diabetes, high blood pressure, physical inactivity. There are the most common risk factor for musculoskeletal disorders beside workplace hazard. For example, frequent lifting, for example, frequent twisting, bending, working the awkward posture, constant standing and sitting. They are most important risk factors for work-related musculoskeletal disorder. As I told you, there are multifactorial disorders. The most important challenge for us as an occupational medicine specialist is when this case open the file against the employer and sue the employer. It is very difficult to make decision how much the disease is related to work, how much is not related to work. And we usually try to solve this cases in the group with the special committee. Occupational accident. As I mentioned earlier, we have 5 categories of hazard at workplace that can cause occupational diseases, and other group are safety hazard that my colleagues in the previous presentation talked about it. As you know, occupational accidents are more common than diseases at workplace, like falls, trips, slips, machinery accidents. But but unfortunately, the fatal cases of work-related problem most of the time is related to occupational disease. It's based on the ILO report shows the 86% of fatal cases among employee are related to occupational disease and work-related disorders, not occupational accidents, although occupational accidents are more common than disease at workplace. Why occupational disease has more than accident mortality? Because, as I mentioned before about, for example, noise inducing loss, most of the occupational disorders doesn't have any significant symptoms. The patients are asymptomatic. And sometimes the work related, when there is a during medical examination, patient that go to for visiting the visiting by doctors, the doctors doesn't recognize this doesn't recognize this medical attention to this disease. And if the doctor pay attention to this disease, the work relatedness doesn't recognize, because it needs a special knowledge and skills to diagnose the work-related disorders. Primary care physician most of the time, or general physician that work in the treating clinic or treating hospital usually doesn't have adequate information about occupational disease. So most of the time, healthcare system and healthcare setting, occupational diseases miss, and they didn't report, or they usually don't report and don't diagnose. Let's review some statistical data of ILO about occupational disease and occupational accident. As you can see in this slide, 395 million accidents happen at work yearly, and 215 million occupational disease. We have 2.9 million deaths caused by work-related disorders and work-related illness every year. Almost every 15 seconds, we have a case of fatal case of occupational disease or occupational accidents, and about one in five employees suffer from kinds of occupational disease. What should we do for occupational disease prevention? And what is our plan? What should we design in at workplace as an occupational health team? The result, the response is completely, totally clear. The prevention is the best strategy to control and manage occupational diseases at workplace. Because as I mentioned before, most of the time occupational diseases don't have any known treatment, known, and they are irreversible. So we should try to prevent them. And occupational disease, fortunately, almost always are preventable. Prevention protects workers and protects and promote productivity and promote quality of business that most employer is looking for. There are three levels of prevention in medicine. It is a general rule for all diseases: primary prevention, secondary prevention, and tertiary prevention. It is true also for occupational diseases. Primary prevention in field of occupational medicine and preventing occupational disease, we should stick to hierarchy of control of NIOSH, National Institute of Occupational Safety and Health. In this model, we have five levels. The first level that has a best priority and it has a most effectiveness is elimination. It means physically remove the hazard. For example, if there is a device or machine at workplace with producing noise higher than 85, you can delete it, you can remove it. In the second level is substitution. Substitution means replace non-hazardous chemical with hazardous chemical. For example, replace glass wool instead of asbestosis. Replace man-made vitreous fiber instead of asbestosis. This is a one of the best intervention for preventing asbestosis at workplace. The third level is engineer control, designing ventilation, some ergonomic intervention, for example, giving office worker adjustable desk, or for example, design a specific chair for employee, and some engineering control are the most effective way to control hazard at workplace. Administrative controls are the next level when we can afford and we can perform engineer control. We should go through administrative control. They don't need any technology, any machine, and they are low cost intervention. For example, designing work rest cycle. For example, training employee. For example, changing their shift work of employee, labeling hazardous chemical. These are at some kind of administrative control to prevent occupational disease. And then last option to prevent occupational disease is prescribing personal protective equipment. They are very most popular among employer and also employee. And most of employer prefer to go straight to PPE. But as you can see in this slide, they have a least effectiveness to prevent occupational disease. There are a lot of PPE during in this conference, in the exhibition, respirator, different kind of uh, hearing protection device. But don't forget it. They have a least effectiveness. When we can perform other levels, yes, it is a good option, but it is not the first and the best option to protect and to protect the health of employee and control occupational diseases. As we can see in this slide, primary prevention is the most important responsibility of occupational hygiene team. Anticipation of hazard, recognition, evaluation, and control of hazard is the most important responsibility of occupational hygiene team in the workplace. In the secondary prevention, there are medical surveillance or health surveillance intervention. For example, pre-employment medical examination, for example, periodic medical examination, a specific medical examination. Which tests we should perform, we should prescribe for our employee. How often we should perform them. We should do, for example, an audiometry every year or every 2 years. We should do blood tests, for example, a screening for diabetes, high BP every year or every 2 years. It depends of many factors. Age of employee, workplace hazards, underlying disease are most important factor to make decision about which tests are helpful and what is the interval of this test. There are not a one fit for all package for medical surveillance. We should design this package with your occupational medicine specialist or occupational health physician in your team and try to prescribe a low cost and effective and test with positive predictive value for employee without wasting the money. The data we extract from health surveillance, beside the data from hazard surveillance, help us to identify high risk jobs. After determination high risk job, we can do job analysis and design work intervention and implementation and design feedback for earliest step and give feedback to earliest steps of this cycle. The most important thing is for preventing occupational diseases workplace, you should have a system. You should design a loop. Occupational health surveillance and occupational health program not is not a, for example, a medical examination every year or every 2 years. Doing, for example, blood tests or urine tests every 3 years. It is not occupational medicine. It is not occupational health surveillance. It is a kind of a screening, general health screening for occupational health program. And if you want to prevent occupational disease effectively at workplace, you should have a systematic approach. Systematic approach for preventing occupational diseases and also for all other diseases is the occupational health surveillance. Occupational health surveillance include data collection, data analysis, data interpretation, communication between all stakeholders of occupational health and safety team, and evaluation the effectiveness of your program continuously. You should design a loop and a cycle and monitor this cycle continuously. The most important members of this team, I mean occupational health team, are occupational hygienists and occupational health physician with adequate information and effective training in field of occupational medicine or a specialist occupational medicine to design this protection and this intervention activity. The the third level of prevention is tertiary prevention. In this level, unfortunately, we face with the employee with disease or the employee suffer from occupational accident. I mean, the previous levels don't be effective, and in this level we are dealing with the patient. We should try to minimize the effects of this disease and this accident on his productivity or her or his productivity and her function or his capacity. It is our responsibility. For example, if we have a employee that want to come back and return to his previous job after myocardial infarction, we should help him. We should do medical examination and try to manage his return to work by some intervention. Maybe he has a partial disability, maybe he has a total disability, maybe he can come back to his previous job without any limitation. He doesn't have any significant problem. Maybe he needs a temporary job modification. Maybe he needs uh, permanent job modification. It depends on severity of disease, medication, workplace hazard and exposure, and you should make decision as an occupational health team and provide for him some effective services. For example, another example is related to work-related musculoskeletal disorder. You should design a rehabilitation program, vocational rehabilitation for employee that's help to him to return to work and try to manage sick leave of employee. One of the most important issue and problem at workplace is sick leave management. You should have a plan for sick leave management. And as you know, the first etiology and first reason for sick leave or common cold after the low back pain is the second cause of sick leave among employee. There are different model for prevention of occupational disease. This is a OSHA model, Occupational Safety and Health Administration. As you can see in this slide, this model has 7 core elements. the first step is management commitment or management leadership, and the second level is worker participation. I mean, as you know, management commitment and leadership and employee involvement are two of the most important steps for designing occupational health and safety program. This third level is hazard and identification and risk assessment and hazard prevention and control. As I mentioned earlier, they are the most important responsibility of occupational hygiene team. Design training program and evaluation the progress of our program or intervention, and use indicator or auditory system to monitor the system, and communication and coordination between all stakeholders of occupational health and safety program. In my opinion, I think the most important responsibility of occupational health and safety team is performing and designing and following this communication, because occupational health and safety is everyone's responsibility, but occupational health team is the core. We should manage this condition. We should design collaboration and communication with other part of business, other parts of, for example, industry, and try to help to gain their help, their support to promote health and safety program. This is very critical. As an occupational health team, if you can perform this task well, and you can design this collaboration and communication well, I think all other occupational health and safety program automatically go well. Other model is related to WHO model. It is a model for healthy workplaces that recommended by the WHO. As you can see in this slide, the first level and the second level are similar to OSHA model. In the next step, we have business ethics and legal. As you know, all industry, all business should follow occupational health ethics and medical ethics, and also follow and stick to to local guideline and regulation. And in the key number 4, you should use a systematic and comprehensive process to ensure effectiveness and control improvement. As I mentioned before, it is a very, very important. You should have a systematic approach to occupational health program. And the last step is integration. Integration occupational health and safety program and policy to all other program of your business, and goals to other strategic plan, the organization strategic plan, and culture. It is very important to help to gain the support of other department at workplace, and also top management. And finally, in the last slide, I must emphasize on occupational health for managing occupational diseases at workplace and preventing them. You should design a loop. You should evaluate and anticipate workplace hazards, evaluate health hazard and workplace hazard, and control health hazard at workplace, monitor employee health, and monitor all members, all items in the cycle continuously. If the cycle is complete, the chance of occupational diseases and injury decrease. Otherwise, you will face every day to new occupational disease or occupational accident at workplace. And as I mentioned before, occupational health is not a general checkup, is not a regular urine test, blood test, check BP of employee, for example, or treating the patient with common cold at workplace or low back pain. This is not occupational health. Understanding the occupational health cycle is a key to safeguarding workers' health at workplace. Thanks for your attention, and thank you for your time. Thank you so much.